This morning, advocates across Arizona, they are coming together at the state capitol to raise awareness about ALS and push for better access to care. The event kicks off just minutes from now, bringing patients, families, and lawmakers face to face. Joining us live this morning is Deboni Park with ALS Arizona to talk about why today really matters. So good morning. Thanks for joining us. So tell us what's happening today at the state capitol.
Thank you so much for covering this. So at the state capitol today, it's our ALS Awareness Day. And what we're doing is this day is being proclaimed ALS Awareness Day across Arizona to raise awareness. We are setting up flags right now that will represent the 5,000 plus individuals diagnosed with ALS since 1991 when our organization was founded. And then we have stories, individual stories of people living with ALS, their caregivers, providers, all of that across the state are here as well. We have an education tent to educate people on what ALS is, and we'll also be meeting with legislators to do a lunch and learn to share about ALS with them.
What are you hoping to get with those lawmakers here in Arizona? To see legislation change, to get more help? What's the goal with that?
So we actually have active legislation this session that is working on improving Medigap for people under 65 with ALS. When you're diagnosed with ALS in Arizona, if you're 65, you can immediately get on Medicare, which covers 80% of your coverage. But if you're under 65, you cannot access the 20% coverage, which is Medigap. So in most states, individuals with ALS can access this. In Arizona, they cannot, and we have active legislation working on changing that right now.
This really does impact people. I have talked with people who have been diagnosed with ALS, for stories here, and it is a devastating diagnosis for the person and for the entire family.
Yes, absolutely, and incredibly, incredibly expensive. I was just speaking with someone recently who's 55 years old who needs a custom power wheelchair. They're completely immobile. They really, really need it, but they can't afford that 20% copay because they're not 65 years old. They cannot access Medigap, and they're in a real bind. So our organization provides loaner wheelchairs and supports them the best we can. But with this disease, with full immobility, you truly need something customized to you. The copay is so high that they're not able to access that. So our Medigap legislation will change that. It's so important for these individuals.
Do you have any idea how many people here in Arizona are impacted by this disease?
Yes, at any given time, there's around 550 people living in Arizona with ALS. Around 175 of those are people under 65 years of age. So the average age of diagnosis is about 40 to 65. So it actually strikes people younger more than people realize.
What about a cure? Obviously, this is something that at this point, there's really not a cure. Do you see any potential on the horizon for people? That's always the hope with this disease here.
Yeah, absolutely. So there is so much research. In fact, even in our own state at Barrow Neurological Institute, there's research going on, active research. There's research across the country. When the Ice Bucket Challenge happened over 10 years ago, it raised a lot of awareness and funding for research. So that has been actively going on. And one huge breakthrough was a medication called tofersen that helps people with genetic ALS, which is unfortunately a small variant, but it's seeing real progress and real change. And it is showing us that this can happen when it is funded enough. So that's really what we need is more funding.
All right, Deboni Park with ALS Arizona out there at the state capitol for us this morning. Thank you for joining us, and we wish you the very best out there today.
Thank you so much. We appreciate it.
Yeah, have a good one.